5, I don't know, how many? All right, so flail segment, 2 or more ribs broken in 2 or more places. So, take a look here, okay? Flail segments, how do those present?
Paradoxical movement.
I don't know what paradoxical movement is.
Opposite
As
movement.
the chest wall goes
That's
out.
good. Everybody get this?
Chest wall goes out.
It does this.
The ribs move out and when you breathe out. It's an opposite movement. Sorry.
What did you say?
When you breathe in the rib.
You always start off talking loud, and then they're like, hey, I'm not deaf, young man. I'm like, oh, sorry. Sorry, what you got now?
When you breathe in, the
Oh,
rib
much better, I can hear you.
moves out, and when you breathe out, the rib moves in.
All right.
It's an opposite
It's the
movement.
opposite reaction of what your lungs would, or your rib cage would normally do. Okay? Take a deep breath. Chest wall expands, right? Boom. So what normally happens, it's gonna suck in. Okay? And then you let out, it starts to do, boom, out pops this crazy looking like patch. They're actually pretty awesome when you see them. Right? You're like, that is a flailed segment. And you're like, oh, what does flailed segment mean to us as paramedics? First thing that we should think is
Possible tension pneumo. All right, possible pneumo.
Life threatening. Get to the hospital.
Why? Ooh, yes, see, you mumble. See, I love it when people mumble and be like,
I know how it feels.
and then it's just like, oh,
Because
you're
it
right on
can
target,
cause
but why do you
damage.
get to the hospital?
Because they're gonna die.
And how do you get to the hospital? What is important with you in the hospital?
They have all the resources to go.
But why? What? Yeah, man, I'm gonna sit down. We're over here. What's your turn?
Why are we getting to the hospital?
Why? Well, you talk about the resources at the hospital, and you talk about they need to get to the hospital. What?
Exactly.
What in regards to this condition? What about this condition?
You're stressed where you're at.
I know. In the hospital are key. Hospital, what you have on the board right now. You put those two things together. What does that equal?
Success.
Well, that's only if you take yourself out of the category.
Oh.
Okay, Blake, go ahead and bring it.
Yeah, it's a trauma
It's
activation.
an automatic trauma
Oh,
activation,
shit.
right? I know, it's hard, it's like without saying, hey, is this a trauma activation or not? Without like prompting you to say, hey, trauma activation or not, right? So, with this, it's a trauma activation, so what's that do to our thought process? Immediately.
They need surgery. Yes, he said it and I didn't.
Everybody hear what Noah said?
Yes, these are
Noah said diesel therapy. No?
Uh-oh.
So I learned something yesterday. We had a Zoll rep come in. And he was showing us how to use like the X series and everything. And he says, hey, so I figured out a way to keep you guys on task. Every time you guys ask a dumb question, and he goes, by the way, there's no dumb questions, or if you guys start acting out of line or something like that, I put your name on the board. So right now, Noah is number 1. So what happens here is, as we move along, at the end, whoever ends up number 1 ends up to volunteer to be paced. And he's like, it's amazing how well firefighters suddenly are focused on exactly what I'm talking about. So the cool thing is Noah's volunteered to go first.
Yes.
So let's see if anybody else can bump Noah, because the way it works is
I
the
saw an
next
old man
person,
cry the other day because he got me.
right? So it's not very comfortable, right? And we don't have Versed, we don't have ketamine, we don't have fentanyl, right? So what happens is the next person will go above Noah, and Noah then becomes number 2. So then it just kind of things. So like being early on, it's kind of okay, but what you don't want to do is you don't want to be the last person on top. So it's kind of interesting. So diesel therapy, great answer, good answer. All right, so back to it. So what are we thinking with this?
Why is it a trauma entry? Is that what you're asking?
No, what is important because of the fact that it's a trauma entry?
Lung sounds,
Airway supplements.
What does that do to our thought process in regards to, we have a trauma activation, mandatory trauma activation criteria, we've called it in, we've done all that stuff, like we've recognized that this is a trauma activation criteria. What this does to our thought process, everything has to speed up. We have 10 minutes to get everything done. Gone are the days. So say this person has ground level fall, right? Little old lady, ground level fall, little old man, ground level fall, boom, they trip, they fall, they hit their chest on a coffee table, right? What do we do to those kind of patients? We love them to death, right? We smother them with love, we take care of them, we do that thing, right? But what we don't do is we don't get in this process of, hey, this is a trauma activation, like mandatory state advisory board trauma activation criteria. You have to be gone off that scene unless you have a good reason within the 10 minutes. Or your stuff gets pulled and reviewed, right? So as you recognize these things, you're like, oh, whoa, hey, you got shortness of breath, oh, you fell, okay. We're actually gonna touch people, just so you guys know, you're touching patients. I know it's a scary thought. New paramedics and paramedic students are horrible at it, but we're gonna touch, okay? You find this stuff. That's the only way you're gonna find. Are you gonna go and just lift up a little old lady's shirt and be like, oh, I'm looking for a flailed segment, just so you know? How are you gonna find it?
Feel.
Right? You're like, hey, does this hurt? Oh, it kind of hurts here. It's like, ooh, okay, take a big deep breath for me. Yeah, I can't. Yeah, they do this little gasp thing. You're gonna feel crazy, crepitus, and you're like, ooh, you got some crepitus here. And like, sorry, ma'am, I gotta take a quick peek. We gotta just make sure you're okay. You lift it up, and that's when you go, whoop, whoop, whoop. Good. Okay, we're gonna cover that back up. I'm gonna just hold my hand here for a second, and we're gonna get some equipment. We're gonna bandage you up, and we're gonna get you going to the hospital. Right? So right then, everything just, you put everything in fast forward now. You're like, okay, all right, thought process. Okay, do I need C-spine? This is a distracting injury. Gotta run through that real quick. Do I gotta put this person on the board? All right, what am I doing? Cardiac compromise. Are we stable? Are we unstable? Right? We start running through those thought processes because you guys are awesome. You guys can think fast now, right? You guys are all keeping up, right? All this is in your head. You're thinking this, right? Everybody keeping up?
Yes.
You've run all those questions in your head since I started, yeah?
Absolutely.
You're all lying, so anyways. So that's the kind of thought process you guys need to start getting yourself wrapped around and being like, okay, I can go from loving this patient and doing all the hand holding and, okay, let's get you up off the ground, let's move you to here, let's do some full vitals, let's get you comfy, start an IV, right? It's like, okay, boom, you guys are ambulance, you bring the ambulance with you, remember now. Hey, we gotta get going. This is something that is a significant thing, and this person, it can make this person very injured and sick and result in death. Right?
Dun, dun, dun.
Alright, so how do we manage it? What's the term? Bulky dressing, right?
Heavy.
Heavy bulky.
Just-
Gotta be heavy, right? Like sandbags, something like that. Some people will throw like a single IV bag. It's gonna take a couple IV bags. You're gonna have to wrap it tight. You're gonna have to really hold those lungs. And all that's really doing is allowing they're gonna feel like, oh, I can't take a deep breath. And all it's really doing is it's keeping the thoracic cavity intact. So as they take that breath, the lung is not trying to pop out through these extra chunky sections of ribs that are moving, right? So it's keeping that in place, keeping the lungs in place, which then allows good oxygen exchange. Why is this life-threatening?
Because it has a potential. There's.
What do these do?
They're gonna cut all those arteries.
Do things
Veins.
break? Like, hey, I'm gonna take a saw and cut this off perfectly like that? How do bones break?
Structures.
Right? So you run the risk of puncturing the lung. So, is this a 5-minute reassessment, or is this a 10-minute reassessment patient?
2 minute?
So ultimately, if it's a flail segment by itself, is this life-threatening? No. It's everything that comes along with the flail segment that you run the risk of it being life-threatening.
Just a broken phone.
Alright, so we do our needle decompressions, right? What are we watching out for?
The arteries and veins underneath.
So if this is completely shredded here with bone, what runs here as well?
The arteries and veins.
All those arteries and veins. So now you have vessel potential damage, okay? So not only can you puncture the lung with these portions of the rib, but now you have vessel damage that can happen. And then what happens with those when those vessels bleed?
Fill the lungs.
What can that turn into?
Hemopneumo.
A hemopneumo, right? Do we decompress a hemothorax?
Yes, because you don't know if it's a hemo or a pneumo.
Okay? But at what point do we needle decompress a hemothorax?
When it's tension.
When you get your cardiovascular compromise and it's presenting like a tension pneumo, right? So you will get so much blood in the chest wall cavity
that it starts to shift things as well.
Would you, if you have a suspicion of a chemo, can you, whatever this is called, get more of that?
Anybody know what that's called?
Percussion.
Hyper-resonant?
Oh, thank you, Blake. Oof, man, I
He's
thought,
so
I thought we were gonna go 0 for 24 here. So, hyperresonance, so that's an absolute thing. So, what would you expect the difference to be between boom, 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 right? Because it's full of fluid versus full of air, right? The hollow, kind of like think about if you're checking a watermelon kind of thing. Everybody knows the perfect way how to check a perfect watermelon, right?
Theoretically.
Pat it, right? Yeah, flawless. Every time, you get the perfect watermelon. No. So, it's a great idea if you do it on every patient, right? If you're doing hyperresonant checks on every patient, then you know what hyperresonance sounds like normally, right? But if you do it for the first time on a patient that has blood in their lungs, you're gonna have no clue what you're looking for.
But you can compare it to the other side.
And you can compare to the other side, and then you're like, okay, which one? I don't even know which one has blood in it. It's like, so you end up running that risk. So we try to practice these skills on non-emergent patients so that we know on the emergent patients. Same kind of thing with IVs. Do IVs on the way to the hospital in non-emergent patients, right? So you get the practice of doing it in the back of the ambulance as you bounce down the road on a critical patient that you really need it. So those kinds of things. So we're always practicing our skills on patients that even that don't need it, right? Simple pneumos. Those are perfect patients to come up. COPD, respiratory distress, perfect patients to try your hyperresonant stuff on. Okay? All right, so we wrap that, we package that person's good to go. Yeah?
That's where we put our 2 fingers and we tap our knuckles on top of it.
Yep. All right. All right, case study number 2. Oh, jeez. All right.